As healthcare providers, staying on top of the constant updates to Medicare and Medicaid billing rules can feel like a full-time job. With all the changes to government healthcare policies, it's easy to fall behind. To help you navigate these changes, we've gathered advice from some of the top experts in the field. Whether it's about telehealth billing or ensuring proper documentation, their tips will help you stay compliant and make sure your practice is getting paid the right way. Expert Insights. Dr. Emily Harris, a healthcare consultant, stresses that Medicare and Medicaid billing can get complicated, especially as rules evolve. One of the most important aspects of getting reimbursed properly is accurate documentation. She points out that clinical notes should clearly link to the services provided, as poor documentation is one of the leading causes of claims denials. In fact, improper documentation results in over $1 billion in denials each year. Michael Thompson, a health system administrator, shares his experience with frequent changes to Medicaid billing codes, particularly in the area of telehealth. He advises providers to make sure their practice management software is updated regularly to reflect the latest codes. If your billing team isn't fully trained on these updates, you could face delays in reimbursement. In fact, a recent survey found that 70% of healthcare providers experience reimbursement delays for telehealth services due to outdated billing systems. Karen Williams, a billing and compliance expert, highlights another area that often causes issues for providers: billing frequency and service limitations. She explains that both Medicare and Medicaid have rules about how often certain procedures can be billed, and not adhering to these limits can result in underpayment or denial of claims. She also shares a real-life example of a healthcare provider who lost $150,000 in revenue due to incorrect billing frequency for diagnostic services under Medicaid. Quick tips for busy providers: staying on top of Medicare and Medicaid, billing updates, ensuring thorough documentation, updating your practice management software regularly, and being mindful of telehealth billing codes can help streamline the reimbursement process. Also, understanding billing frequency rules will prevent any lost revenue. Wrapping it up, the world of healthcare billing is constantly changing, but you don't have to navigate it alone. By following expert advice and ensuring that your practice is up to date with the latest regulations, you can avoid reimbursement issues and stay compliant. Keep educating yourself on the latest changes, and you'll be in a much better position to succeed in the face of ongoing updates. For references, Centers for Medicare and Medicaid Services updates to telehealth policies and billing codes. The Centers for Medicare and Medicaid Services recently released new updates to telehealth policies that providers need to follow to ensure proper reimbursement for remote services. New rules on Medicaid reimbursement for diagnostic services, a recent shift in Medicaid reimbursement rules for diagnostic services is affecting thousands of providers. Make sure you're on top of these updates to avoid issues with billing. How documentation errors affect Medicare billing. A new study highlights how improper documentation is a leading cause of Medicare claims denials. It's costing providers billions, so it's important to stay on top of your documentation.